A virus that killed over 1,300 people in a single year has just been declared over. This is Kenya News Update today. Coming up, you'll discover how Africa just pulled off a public health miracle, why the world ignored this crisis for decades, and what this shocking victory means for the next pandemic. Meet Jean Kaseya, the Director General of Africa's CDC. On a Friday, he made a historic announcement that changed the continent's future. But here's the twist. This isn't just a story about beating a virus. This is a story about a continent that was forced to save itself. For decades, Mpox outbreaks in Africa received limited international attention and almost no investment. African countries had little to no access to vaccines or treatments available elsewhere, despite carrying the heaviest burden. The inequity was staggering. And then, in 2024, everything exploded. Transmission surged across Africa. More than 80,000 suspected cases, 1,340 deaths recorded. That was more than 5 times the cases and double the deaths from the year before. The Democratic Republic of the Congo was devastated, accounting for 96% of all cases and 97% of all deaths. The system was failing. But here's what nobody saw coming. African leaders refused to wait. They convened a high-level emergency regional ministerial meeting in Kinshasa in April 2024. Political commitment was galvanized. And then, Africa CDC did something it had never done before. Using its expanded mandate, it declared Mpox a public health emergency of continental security in August 2024. It was historic. The first time Africa CDC activated this power to coordinate a continental response. An incident management support team swung into action. And then something shocking happened. The numbers began to plummet. Between early 2025 and late 2025, suspected Mpox cases declined by a staggering 40%. Confirmed cases dropped even more dramatically by 60%. The coordinated action worked. Health systems were strengthened. Regional cooperation proved decisive. And this week, the emergency was officially lifted. Jean Kaseya said the decision reflects Africa's growing capacity to manage complex public health challenges. But here's the part that will blow your mind. This victory exposes a painful truth. For decades, the world looked away while Africa suffered. The long-standing gaps in response were not an accident. They were a choice. Limited surveillance, no diagnostics, no vaccines for the people who needed them most. These inequities, Africa CDC noted, directly contributed to the scale and severity of the outbreak. So this isn't just the end of an emergency. It's the beginning of a new era. Africa has proven it can lead its own health security. The implications are massive for the next global health threat, but the controversy remains. Some call this a triumph of African leadership and partnership. Others say it's a damning indictment of a broken global health system that only acts when a crisis spins out of control. The emergency is over. But one unanswered question hangs in the air. If Africa can mobilize this effectively for Mpox, what's stopping the world from fixing the inequities that caused the crisis in the first place? Do you think this African-led victory will finally change how the world responds to health crises on the continent? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news that impacts you.